Hello, listeners. Welcome to Views on Health. And yet another Monday evening has come by, and the focus on the program tonight is neck pain. And to tell you all about neck pain and why it's important that we take notice of it is Dr. Sanjeewa Garusinghe, consultant neurosurgeon of the National Neuro Trauma Center, National Hospital of Sri Lanka. I'm sure listeners will recall that we did have Dr. Sanjeewa Garusinghe recently when he spoke on headaches and hidden causes. As we said, tonight on the program, it's neck pain. Welcome back, doctor, and the microphone is yours.
Right, okay. Yeah, Fatima, I think this is, I think even with the previous discussion, we talk about the neck pain can associated with headache as well. So today I think you want me to talk about the neck pain. And neck pain is one of the very common symptoms nowadays, especially the middle-aged and age population who worked regularly, especially they are doing desk job, looking at their laptops or the computers and bending their head towards their devices and the mobile devices. So there can be many causes for neck pain, but there are particularly few causes for the neck pain symptoms, depend on their age and their habits and their occupation. So as I said, it's very universal. I mean, you get neck pain, everybody experiences neck pain, and there are certain instances where you seek medical advice, and you first start with simple medication, and you see whether it goes down. If it doesn't, then that's the time you have to meet your doctor.
So, doctor, what triggers these neck pains? You said it can be related to headaches also, but otherwise, what triggers the neck pain? And when should a person, like any other ailment, think this is not something that is going off, or this is not something that I should ignore? I need to see a doctor.
Correct. Yeah, if your neck pain goes more than 3-4 weeks, we call it 6 weeks, 1.5 months. And if your neck pain is associated with pain down your arm, we call the pain radiating to the arms or legs or back of your spine. And the neck pain associated with a weakness in your body, for example, the hand weakness, numbness. And neck pain is disturbing your sleep. You can't sleep because of bad neck pain. And yeah, those are the instances where you can't. The other instance is where you can't walk. You have the bad neck pain, numbness of your body. Your legs are not working. Your hands are not working. You can't get up from your chair. You can't walk. That's the point you are going to speak to your doctor, other than the cause of the instances which I mentioned before.
So who is affected? Would it be the young, the middle-aged, the elderly?
Well, I mean, the neck pain, we call the commonest symptoms cause for neck pain is degenerative disease. The term degeneration is one of the common thing we do get in our life. The degeneration is, as the name implies, is you lose the integrity of your normal body, especially the bone, spine, and nerve. So that happen after 35 years, or say 40s. So then that is a point you get the neck pain, back pain, and those degeneration of your neck is the root cause for your neck pain or the back pain or your neurological symptoms.
But how do you know that it's happening? Of course, the signs will be there, the symptoms will be there, that your pain and all of that. So this condition, the degeneration, is it serious?
It is not serious because there is a normal aging process. I mean, the problem comes with the degeneration if you have nerve impingement or nerve compression, and you have the bad pain, you have disc prolapse, we call about lumbar or cervical or neck disc prolapse. Then that is a place we as a surgeon or a neurosurgeon, I need to do something. So to confirm that, essentially we need to see you, talk to you, examine you, document your symptoms, and the investigation of choice is MRI scan, if you scan spine.
Doctor, talking of the scan, which you spoke of even before, and your colleagues also speak of the MRI scans. I'd just like to focus on it right now. The fact that you go through this process of going through the scan, I'm told it takes about 45 minutes. Is that right? Or is it half an hour?
Depend on the protocol. Sometime 45 minutes, sometime 30 minutes. Sometime it might take small 1.5 hours longer. Yeah.
Right. So and the scan will show you exactly what is wrong, what you're looking for. You're looking for something.
Correct.
And the scan will help you to see what you say.
Correct.
How does that work? Where the scan, the whole body is going through that process.
Yeah.
So at which point or rather, once it's done, how would you ascertain that this is what I'm looking for and it is here?
Yeah, what you do is, MRI scan is a very safe procedure. It's not like CT scan. So CT carries a lot of radiation, but whereas the MRI doesn't carry any radiation. It's a magnetic field. So when you go to MRI grant, your MRI room, you shouldn't have any metal devices with you. You keep your mobile phone, you keep your credit card, everything. You remove all the metal devices, and then you go to MRI department. And the only concern is if you are claustrophobic, but you'll have to lie on the MRI grantee, MRI table alone, and you feel little kind of fear. But you must know that these are hospitals. You have all the equipments to safeguard you. For example, we are doing the MRI, we monitor your heart rate, we monitor your respiration, we monitor your blood gases, saturation, and you can talk to us like we have the microphone and speakers, and you hear us, we hear you like that. It's very safe procedure, and we are next door. We are in the other behind the glass door. So when you do the MRI, what we do is we take pictures of your spinal cord. When we talk about the neck pain, we talk about the neck spinal cord pictures. So there are different planes of images we call axial, coronal, sagittal. It's 360 degree whole spinal pictures, series of pictures, and a radiologist, a dedicated person who specialized on reading the MRIs, going through the films, and next the neurosurgeon or the clinician again going through the films, and we tend to tally with match with your symptoms and the changes you see in the spine. That's how you come to a diagnosis.
So, doctor, now getting back to the neck pain, once you have identified that it is a neck pain, would you first treat it medically, and hopefully that the patient can get over it?
Correct.
Or then, and thereafter, of course, it doesn't. You have to go in for something surgical.
Correct. So there are, most of the time, medical management is the treatment of choice. But there are instances where you don't talk about medical management from the beginning even. For example, you come with weakness of your hand, or you come with night pain, you can't sleep, and if you come with failure of medical management, you are not responding to drugs, and then you may change the drug dosage or the drug pattern. But again, if you don't respond to medication, then you think about surgical option. Then you do the MRI and see what's happening inside.
When do you need surgery, which is a cause of the neck pain?
Well, as I said before, the disc prolapse or the nerve root compression or spinal cord compression and the joint hypertrophy, or we call the compression of neural elements basically. And those are the instances where they do not respond to medications or the tablets or pills. And these are the instances where we as a surgeon has to do something to release the nerve pressure, and then you start with rehabilitation programs, suppressor and rehabilitation. But it's very important, if you have nerve compression, to relieve the symptom, to relieve the pressure. So that has to be done by a surgical procedure. There's no other option for that.
So will there be more surgery involved if if the first procedure doesn't give the desired result?
Well, I mean, the spinal procedures, spinal operations, the first operation is the best operation, I would say. And again, as I described in last discussion, the spinal operations are not bad as before. We had the fear of being paralyzed or bedridden, and it takes long hours, and sometimes there are a lot of complications those days. But nowadays, I must reiterate this: the spinal procedures are very safe in this country, in our departments, neurosurgical departments, and we do the same operations. If you have to get the operation done in developed country like UK, Australia, USA, they do the same procedures, and we do the same. There's no difference, and the procedures are now very fast track. Like you come today, you go home tomorrow. Most of the time, they call 1 day procedures. Most of the spinal operations, some days take a few more days, but most of the time the day procedures. The success rates are very good, like say 90-95% the success rate. So shouldn't have any unnecessary fear about the spinal procedures.
So what is the rehabilitation that you speak of?
Well, I mean, the most important thing is relieve the pressure on the nerves. Once the nerve pressure released by a surgical treatment, like say we call it disc operation, we call it neuro decompression. Once the pressure improved, released, then it's a matter of improving the conduction through the nerves. So that part is done by the rehabs and physio. So you talk to your physiotherapist, you talk to your rehabilitation physician, and you do more work on your affected part of your muscle, and there's a science behind that. So you do the scientific way, and they improve the conduction through the affected nerves.
Can a patient present with more than one symptom? For example, you speak of a disc prolapse in the spine.
Yes.
In addition to that, can there be a patient can have another reason related to the spine that can bring about the neck pain, and which you need to treat? Can there be multiple?
Yeah, it can be multiple. Patient is very unfortunate. You can have multiple causes. For example, you have diabetes, hypertension, and have cholesterol, and you can have 3-4 problems like that in the spine. You can have multiple problems, but those are very rare.
But possible.
Possible.
And you treat them anyway.
Well, we do. If we do identify, we treat everything. Yeah.
Doctor, talking of neck pain now, would you treat a trauma also?
Yeah, I work in major trauma center in Sri Lanka. We do spinal injuries. Very common in motorcyclists. People work in high rising buildings, and even at the household level, the spinal injuries are common. They fall from height, they slip and fall, and you get the spinal fractures. I mean, we do fixation then and there. We do actually within 48 hours we do that.
Within 48 hours?
Yeah, that's the idea. Actually.
You don't delay there?
There's no reason to delay, yeah.
Doctor, going on from there, now such surgery, once it's done, what if there is another injury, God forbid, if it happens again?
Well, I mean, then you have to do it again. There's no excuse.
But how? No, you will do it, of course. You will certainly treat the patient. How serious can that condition be?
Well, I mean, if that happened in the same place, same level, say for example,
same person, maybe even
neck,
one side of the spine, one part, then another part.
Well, that's a bad luck. I mean, if you have the same, now if you talk about the cervical or neck spine, there are 7 bones there. So in between 7 bones, you have 6 spaces. So usually when you do the operation and then you fix it, it's very unlikely you have to have same problem at that particular point. But very rarely that can happen. Then you have to treat it accordingly.
Like you spoke of the brain the last time around, would there be any foreign bodies in this process as well implanted? Would we put?
Correct. Essentially, in the spinal operations, we put implants. So there are some instances we do not put implants, especially in the lumbar. But today the topic is neck. I mean, most of the neck operations we have to put implants. We call cages, sometimes plates, sometimes screws. But they are very safe, very inert products, and they don't have any reaction with your body. And they last as long as your life lasts. So they have no issue with your life.
Would those hamper movement?
No, no, there is no. There may be slight movement restrictions with these procedures, but you may not notice it. So basically, I mean, it doesn't affect your lifestyle.
Does it mean that a person can just do anything he or she wants to?
After the operation, most of the time. That is
Yes.
the idea. Actually, these operations perform, especially neck operations, spinal operations, to send you back to your lifestyle. We don't want to limit your activities. We don't want to have kind of a hesitation for you to go back to your activities. So the operations are done to send you back to your normal life.
Very interesting, doctor, and also very encouraging that such procedures can be done, and a person who has been so affected can get back to a normal life. Now, just another question. As far as age is concerned, if the person is older, I think the chances of recovery will be longer? Or would you say that even an older person can recover as fast as a younger person?
Well, I mean, depend on his or her health. But if, say, elderly do get spinal fractures, which is very common, we do the operation then and there. We never delay or postpone or there's procedures because of the age. Because elderly population need to have procedures done fairly soon, because if they bedbound, they get a lot of complications. So because of that, if we do have patients with elderly patients with spinal fractures, we do it fairly soon. We delay the other procedures, or say other young guys, but we do the elderly first and recover them first.
So you give them importance.
Importance, and give them a chance.
That's also good to know, because our listening audience there will have these concerns in their minds, and they won't be able to actually ask these questions because they're only listening out there. So it's comforting to know that you have all of this in place. You have a multi-pronged team to deal with this situation.
Correct. I mean, in my hospital, National Hospital of Colombo, I work in major trauma center like the Neuro trauma center. We do brain and spinal procedures and brain and accidents and brain accidents and the we call head injuries and spinal injuries, plus the degenerative conditions which we discussed before, like the people do get neck pain and back pain like that. So we have fully equipped department with many theaters. We have 8 theaters, and we have huge backup staff, anesthetic staff, medical officers, theaters, ICUs. The only limitation is the workload, and that kind of return the efficacy and have some kind of a waiting list. But other than that, the trauma is priority. There is no delay for trauma patients, whether it's head injury or spinal injury, but the degenerative conditions, there is a kind of a list, but we do that.
One more question about the elderly. You spoke of a quick discharge.
Yes.
Where the elderly are concerned, would you want to keep such patients a little longer for observation for whatever reason, medical reasons?
Yeah, correct. Because when you discharge an elderly patient, we think twice. For example, whether there is a reasonable adult to escort or keep eye on him at home or the place where he or she lives. That's one of the important things before we discharge. And the second thing, whether they are independent to be discharged, whether they can eat well themselves, or whether they can walk, or they can do their basic, like we're going to washrooms, like thing. So those are the basic things we think. And actually in our hospital we have a separate rehabilitation department ward, where that ward is looked after by another consultant, rehabilitation physician. So we do kind of after the operation, we do kind of a short-term rehabilitation, and we educate their relations how to look after your patient, like that.
Thank you, Doctor. Interesting time is catching up with us. What's your take-home message?
Well, I mean, say the brain and spine injuries are common, as we discussed before. The pain, neck pain and back pain, all these are common things. The most important thing is when it comes to neuron related or nerves related, the most important thing I would say, don't delay. Come to your doctor as soon as possible if you have symptom, and get assessment and see what's going on with you.
Thank you, Doctor. And on that note of advice,
Thank you,
we end
Mary.
this interesting discussion on neck pain to Dr. Sanjeewa Garusinghe, consultant neurosurgeon at the National Neurotrauma Center, National Hospital of Sri Lanka. We say a sincere thank you for being with us on the program and enlightening our listeners on neck pain and the consequences and how you would treat them. Thank you, Doctor.
Thank you very much, Fatima.
Thank you too to Prabha Surya for technical assistance. I'm Fatima Razikada saying good night and hoping to catch you next Monday same time on Views on Health.